My name is Dr. Dan Fisk. I've been with Tepeyac for about 13 years now. And I joined Tepeyac after being with a secular practice across town for about 2.5 years. Before that, I was in the U.S. military for a little over 10 years. I joined Tepeyac because I was finding that in a secular practice I was making too many moral compromises and some ethical compromises that I became increasingly uncomfortable with. For instance, many people seem to have no regard for the sanctity of marriage and sexuality. And joining Tepeyac, I could not only respect marriage and family and the procreative process, but I could honor God in what we were doing by caring for the poor. I also found that for-profit secular practices are very much involved in money making, and that if people needed things to be done, many times they could not afford it, and many lower paying health plans were dropped by the practices. Tepeyac accepted everything, and we took care of the poorest of the poor, and the social safety net, where there were holes in that, we were able to fill. And I was very satisfied that this was in fact honoring to God in what it is that we were doing, and I could use the benefit of my education and skills developed over the years in caring for the less fortunate among us. So I did my first rotation in medical school in obstetrics and gynecology. I realized also that there were many aspects of OB/GYN practice that were not only personally satisfying but professionally as well. It combines many aspects of primary care and long-term relationships with people, as well as lots of procedures and surgery. So it was very satisfying from a professional standpoint across many lines to be both a primary care provider as well as a specialist. But there is no other greater reward than seeing the prospect of new life coming into the world and helping ensure a safe entry into this world, and to be there when the moment of birth is present, regardless of what time of day or night it is. Newborns just never lose their sparkle.